guys, and welcome back to my channel. This week I'm going to give you a guide on how to prepare before coming to an examination in a radiology department, and also list the common mistakes patients usually do for you to avoid before you come to the radiology department for your examination. Let's start with ultrasound. Even though this may vary depending on the type of examination that you receive. If you're going for a pelvic scan, you're advised to have a full bladder, which means you should take a lot of water before your examination, and you should follow a special diet for 12 to 24 hours prior to your examination. You should also shave when necessary. This applies, for instance, if you're coming for a breast scan and you're advised to put your clothes and the doctor would be like, ew, like it's not nice to see, so you're advised to shave and put on deodorant to smell nice. Also, you should wear comfortable clothes. During the scan, if you're wearing a long gown, it won't be nice for you to start looking for something to cover your lower parts. So you should wear comfortable clothes that you will be scanned and be discharged. If you are going for a CT scan, you need to know that you are to wear a hospital gown before your examination, and you should avoid wearing a lot of metallic objects, for instance jewelry, because you are to remove them all before your examination. We don't want it to obscure an abnormality or mimic a pathology, and you should refrain yourself from eating or drinking prior to your examination. For an MRI scan, firstly, you need to tell them if you have any metallic object in your body. You can't have an MRI scan unless if that metallic object is removable. And if you're claustrophobic, you can't have an MRI scan, and you should refrain yourself from eating or drinking, because we don't want you to be having bathroom trips. MRI scan usually takes time for you to step out during the exam. Mistakes to avoid while coming to the radiology department is, firstly, you should bring your old image. Most of the people, if they have their old radiograph, they don't used to bring it when they are coming for the next examination, which is very bad, especially if they don't have it in that hospital. They need it. The radiologists need it for interpretation to ease the diagnosis. And the second one is not fasting. There are certain examinations that if you didn't fast, the bile gas will obscure the area of interest. And the third one is blood works. There are certain examinations, for instance in CT, if they are going to administer contrast media, you need to do your blood test. You need to do the renal function test for them to know if your kidneys are okay for you to have this contrast media in you. And if they are not okay, they can't perform this examination to you. And the fourth one is you not being punctual. It is very good if you set your time for examination. If you already booked your time for examination, you need to come as early as possible. We won't like it to keep you waiting if you're late, because we will admit another patient at that time. No valid referral. It is very good and it is very important to be referred by a doctor, by a radiologist, by a physician before you carry any examination in the radiology department. So if you don't have this valid referrals, you won't be able to get your examination done. So thank you. If you enjoyed my video, please don't forget to like, comment and subscribe. See you next week.